This is where smart business conversations meet real-world experience, where strategies are shared, lessons are learned, and ideas come to life. I'm Emily Galindo, and you're watching Biz Talk, your destination for real insight from the mind shaping tomorrow's business world. Only on Now Media Television.
Hello, everybody, and welcome to Biz Talk. I'm your host, Emily Galindo, and here on Biz Talk, we talk about all things business so that you can have the best business, fastest growing business, most effective type of business that you want. And we are exploring all of those things here on Biz Talk today. And we are joined by an amazing guest, Scott Goodell with Goodell Health Solutions, talking about Medicare. It's about to be open enrollment, and it is important that whether you own a business or are just a regular human being, need to understand this very complicated and sometimes scary and confusing topic, and there's nobody better to talk about it than Scott Goodell. So welcome, Scott.
Well, thank you, Emily. Thank you so much for allowing me to be here today. I'm super excited about being here at Biz Talk.
Me too. We are happy to have you, because a lot of our viewers are, have been in business for a while, and I would assume are getting to that age of about 60, 65, about to retire potentially, and this topic, as we've discussed, because I know you personally, is a complicated one.
It is.
We all have aging parents at minimum, and we get calls and they get the spam and we see the mail and all of the things. So I'm glad that you're here to help us sort it all out.
Yes, I will try to navigate that maze for you today.
Very good. So how long have you been in the Medicare expert space?
So I started in 2018 into the Medicare space because my mom was one of those folks that was confused about what was going on. And so she reached out to me and asked me if I would leave corporate America so that way I could start a business. And so I'm reluctant at first. I'm so super glad that I did it now.
Yeah.
That's why I got into it, is because there was so much confusion, because it changes every year and what to do. And
right. So, to help the viewers, I'm just kind of a 101 is Medicare is a federally funded program to help serve people over the age of 65 and taking care of their health insurance. Is that accurate?
To a point, yes. It's accurate enough to where it's an 80-20 split. That's the only thing that a lot of people need to know. What happens is when you turn 65, what we ask you to do is to go on to socialsecurity.gov, ssa.gov, and then you're going to put in an application, or you're actually going to fill out a profile there. Remember your password. Always do the two-step program, so that way it sends you a text, so if somebody else were to log in, you would be able to know that that's what's happening. But then you're going to go on there and you're actually going to see what Social Security has set up for you. What that means is that at the very bottom of your page, you're going to see a little graph at the bottom, and if it's all green all the way across, that means that you've worked and paid into Social Security at least 40 quarters or 10 years of your life. That's going to allow you to be able to get your Part A, and it's all alphabetical stuff now. So instead of knowing just PPO and HMO from your employer, now we're going to go into letters, because it makes it that much better to go through the alphabet soup. So A, if you have worked 40 quarters or 10 years of your life and you paid into Social Security, in most cases that's at no cost to you. What A does is it takes care of all your hospitalization and anything that it would take for you to be in a bed other than your own overnight. Part B is going to be what you're going to do whenever you want to leave your employer and you're looking to have Part B. What that does is it takes care of all of your outpatient stuff, so including your doctor's visits, any outpatient surgeries, any type of skilled nursing facilities, or not skilled nursing facilities, but like treatments for like physical therapy, things like that you don't have to stay overnight. That's what the Part B covers. And then you'll see a lot of commercials and about different things, but the Part A and the Part B you get from Social Security, and they administer that for you. It depends on what your income level is, on what your Part B premium will be. Right now in 2025, the Part B premium is $185. So when I start talking to business owners that are on a different plan, or they're on a company plan, my question to them is always, do you spend more than $185 a month on your part of whatever the insurance company charges you for your company plan? And do you have more than 20 employees at your company? So that's two big questions that I always ask. And when do you look to retire? Because the full retirement age right now is about 67 years old. And at 67, you are fully vested, which means that you get 100% of whatever the Social Security Administration owes you for the time that you are and the money that you put in. You can go to 70. A lot of folks are now going, as we are aging nowadays, we have great benefits through some of our companies. We have a lot of fine corporations here in the Houston area or in the Texas area, and so a lot of people are staying. If you go to 70, they offer you a better Part B premium benefit, which means that they'll pay you more than what you would if you were at your normal. Anyway, this is confusing, so I'm going to tell you, if you don't know about it or you want to know more about it, contact me. Because there's a lot of moving pieces.
So that was going to be my question. So it started out and that was a great example of how this can get very complicated very quickly, because I was following you right up until that lot, and then you're just like, okay, and then we start having lots of other questions and lots of other moving parts. And so my question would have been, is that why people need to actually, because if I can go to Social Security, if they can go to socialsecurity.gov, why do we need to speak with you? But then we just got to that place where like, and that's why you need to talk to somebody so that they can ask you all of these questions, right?
Right. Because Part A and Part B is only going to give you an 80-20 split. So that means that the government is on the hook for 80% of your medical expenses, and you're going to be on the hook for 20%.
On top of the 185.
On top of the 185.
Okay.
Right. So the 20% is what I specialize in. So the 80% comes from the government, and then I help you navigate what you want to do with the other 20%. We can do, there's two sides of it. You can do a supplement type of side with a Part D plan, or you can go to what you see on TV where they offer Medicare Advantage plans, which is considered the Part C plan, or the letter. And with that, in most cases, there's a Part D embedded in it. So C is Medicare Advantage plan. D is prescription drug plan. F or G depends on when you turn 65 on your birthday, tells me exactly what I can do to offer you that. But in most cases, that takes care of it. You would pay a company or a carrier a monthly premium on it, depending on your age. And then you would get a Part D plan to go along with it, so you're not penalized. There are some penalties that happen within the realm of this, so it's always important to reach out to a trusted person like myself to be able to help you understand what penalties will be available to you, or if you don't have to have them at all. If you're working and you're looking at retiring, that's the time that you need to call me. A lot of people get severance packages, some people get laid off, and we only have a certain amount of time that we can actually get you onto a Medicare program before you're penalized. And so I take pride in finding out what that looks like so we can make that happen. There's a lot of realtors, there's people that are, I own my own company, so there's a lot of people that are out there that own their own businesses.
Yeah.
And they don't have access, and so they go to the marketplace or they find a company out there that allows them to be able to have under 65 benefits. But they need to understand that when they get to close, I would say 4 months before your 65th birthday, we should be talking to Social Security, lining stuff up. They used to allow you to go into the Social Security benefit office, and they stopped doing that. So now it's all online. So if you are turning 65 in the next 6 months or so, I would get on there and get an account set up and start talking about what I wanted to do, especially as a business owner, because in most cases, it's an expense for you to have health insurance. So your Part B premium could go towards the business piece, and it could be a expense for you, like a taxable expense.
Yeah. So, and we've had Holly on here talking about that before, and helping that, and a CPA on here talking about how it is a benefit, and if you need some, here's an option for you.
Yeah.
So the thing for you though is my question. So once we set up this account, now all of a sudden, does my phone start magically ringing with like a gazillion people who want to talk to me about this just like you? So
yeah, what happens is your information is in databases across the country because they know you're turning 65. We all know this because, well, we have birth certificates. And so they get information from you different ways. If you're an AARP member, or if you have put any information into a system with your name and your birthday on it, then in most cases that will trigger an option. Most people that are agents like myself will try to send you like cards to try to entice you to be able to call them. So if you're getting tons and tons of mail and you can't get rid of it, call me. I would be more than happy to assist you and give you all the information at the touch of your fingertips without having to worry about all of that. You can just trash all of it like junk mail. But if you go onto a site that says Medicare and the name of the company is Medicare, that's frowned upon in our industry. It's not a good practice to put the word Medicare in it because none of us work for Medicare. We're all brokers of whatever company we choose to go with. I have 13 carriers that I am licensed with, so I fit your needs to whatever plan suits your pocketbook. And getting that 20% as low as I can to help you with your finances and how you want to build your business.
I love that. And I think that piece of information was really important. So I want to make sure that we all heard it correctly. Like, it's Goodell Health Solutions. Goodell Health Solutions. And so, and you've mentioned this before, but if somebody has the word Medicare in their company name, that is highly frowned upon. It automatically a red flag. This is probably not the right company to be working with, is what you,
Yeah, there's a ton of things, yeah.
Yeah.
You got to do a scope of appointment. It has to be in before 48 hours before your appointment, unless we're at the end of the month. There's a permission to contact. You have to give people permission to be able to connect with you. So if you were to send me a referral, like your parents, you would have to actually, I would tell you to send me an email or send me a text message so that way we could connect, and then I could go from there on what we need to do.
Right, you can't just call them.
I can't.
I can just give you their number and you call them.
That's against the rules. And
Okay.
anytime that you're on a phone call with somebody and if they don't give you the disclaimer that they don't sell all the Medicare plans because we only have so many plans in our area, that's frowned upon as well. So there's a ton of disclaimers and different things because they just don't want people taking advantage of seniors. And so I follow all of the rules that are behind that to stay compliant.
All right. I mean, that's a lot of information, a ton of great information to take away. And because there's so much, we're going to have Scott back after this segment. So we're going to go to commercial break and we will be right back with more information from Scott.
We are just getting started. Stick around and we'll be right back with more lessons, insights, and behind-the-scenes stories from the people driving real business forward. You're watching Biz Talk, only on Now Media Television.